Hey there, welcome to the beginning of our Where Do I Start series. My name is Julie Hirschberg. I am the owner of Re+active Physical Therapy and Wellness, where we do brain-changing education for other therapists. And we get this question a lot. We ask this question of ourselves a lot. Where do I start here? We work with a lot of complex cases, complex neurologic disorders, and it can be really tricky to know how to sort through all of the details and know where to start. So in the first of our series today, we're going to talk about starting with the person in front of you and really understanding and getting to the core of them. We have a couple of great pieces that we use to help with this, and I'll share these with you. One is for the person in front of you themselves, for them to help describe and help explain their understanding of what is happening, what's going on. And it's called Understanding Your Symptoms. We use pie charts a lot, and this is one where they actually create the pie chart and say, you know, I think this difficulty that I'm having has this much to do with my nervous system, my tissues, things going on in my life, and the environment around me. And right now, in the midst of this pandemic, a lot of people are noticing how much the environment and what's happening in their life is affecting their function. So this is where we start, and this is so helpful for any diagnosis, any person, and especially when you have a sense. So somebody submitted a question for us, thank you so much, Kelly, and asked, you know, when what I think as the therapist is different than what the patient thinks is the main issue, or what needs to be worked on. Starting with their understanding and really getting a deep sense of it is the best first step for you. Getting that deep understanding so you can meet them in the middle. Now, it's not to say you don't do your whole assessment. So this is our pie chart. So we start with theirs, what is their understanding, but we need to move into ours. And in particular with the complex disorders, we're gonna look at all of these pieces: motor control, sensation, those underlying physical limitations, some of the psychosocial pieces, the autonomic pieces. And then we can see, okay, well, here's where your pie chart is and what you're telling me. And as I'm digesting this, I'm really listening and understanding, and I can reflect back what I hear, and I can reflect back what I also see, and then come to a piece in the middle of that, right? So that you can get started and start making some progress forward. So I'm going to give you an example here so that you can put this into action. If I have a person, this is happening a lot right now, where they're really recognizing some of the life and environment around them, maybe their sleep habits, maybe they're noticing that they're a lot more anxious and it's affecting what they're doing, but they're also having back pain and they feel like there's something wrong with their back as well. So they'll create their pie chart. We'll do an assessment, and as I'm listening to them, I'm hearing how much the life stress and the anxiety is a big part of what they're feeling, and I'm going to reflect that back to them. I'm going to then also discuss with them, you know, I'm noticing these particular pieces, and let's start where we feel the pie chart is the biggest. So it might be in that psychosocial autonomic realm, and we might start as simple as validating and expressing understanding of that, and starting with some simple autonomic toning techniques, paying attention to the breath. That makes me take a big breath myself. Doing grounding techniques, so grounding through the feet, grounding through the hips and sitting. Those would be a great way to start with that autonomic and psychosocial piece. So I know that doesn't solve all the world problems, but it's a little tiny piece of where to start when you have a big complex picture in front of you. And we'll see you next week for the next piece of where to start with these little tidbits. I'll also share with you our pie chart that's really helpful for understanding the person in front of you. Thanks so much for joining me today.